Hi, I'm Dr. Sean. You must be my cranial nerve today. Yes, okay, great. I've just got to write a few notes and look very important and proper here for a moment. Not at all an awkward silence. Okay, so put my gloves on because we don't want to cross-contaminate any germs from you to me or from me to you. How are you doing? Yeah, well, it's nice and quiet at the moment. I mean, it was pretty crazy the other day. All happens here, I tell you. Yeah, it's can get pretty cray-cray. But anyway, it's nice and quiet, so we can have a nice relaxing time. Yes, believe it or not, cranial nerve exams can be extremely relaxing. Just ask the 17 patients who fell asleep on me. Not physically on me, but yeah. One or two of them started dribbling. Yeah, they were quite embarrassed when I woke up actually. I just had to assure them it's happened before. Twice. And you're one of them, so don't worry too much about the dribbling. The other person was 83 years of age and you're only 20 something, so yeah, it was a bit embarrassing for them. I digress. Right, so what we're going to be doing, nice and simple start. I want to ask you a question, and that question is to do with the nose. Yes. And that question is, have you noticed any changes in smell at all recently? Okay. So I'm going to write that down, okay? So that was, believe it or not, a check for the very first cranial nerve. The olfactory nerve, we call that, okay? So we're going to check the second nerve now, which is the optic nerve, okay? So I'm going to be visually inspecting your pupil's alignment, okay? We'll get a little bit organised here. Get my other tuning fork because it does have a nice sound, okay? Be back in just 1 minute, okay? It's just over there so I won't go far, okay? Stay nice and relaxed. Okay, there we go. So it's a little bit nicer on the ear. Yeah, I like to go out my way for my patients because I care about them. Yes. Okay, so what we're going to do, I'm just going to be checking the pupil's alignment and size. Okay, so if you can just look wherever you want to, it's fine. I'm going to get very close to you here. Okay, keep looking, well, keep your eyes open basically is what I want you to do. Which may be easy now, but in a few, well, about 10 minutes time might be a little bit more tricky. Yeah. Okay. Yeah, I tend to bore my patients to sleep. It is a skill I'm learning to sort of embrace. Yeah. Okay, so that's fine. No worries there. Okay, so I'm going to be asking you to read off the letters that I point to. Okay, so I'm going to take a step back here. We're going to concentrate on the first two rows to begin with, and then I'll get a little bit closer around about here. And then we'll do the two middle rows, okay? We're going to test each eye individually. It's important that we do that because we want to isolate any problems that occur in, an eye rather than, yeah, it's no good testing both together. So let's take my word for it. Makes sense. Alright, so if you could close over your left eye for me. You can cover it with your hand or keep it shut with a wink. Don't worry about playing patience, wink at me. Alright, so I'm going to point to a letter. I want you to tell me what it is to the best of your ability. If you're not sure, give the best guess. Alright, so with the left eye closed for me. Thank you, and here we go. Okay, you did really well there, okay. Yeah, you did well. Now if you close over your right eye for me, we'll do exactly the same, albeit backwards. Okay. So when the right eye closed, thank you, here we go. Okay, now I've got to stand arm's length apart from your shoulder. There we are. And we're going to do the same again, or the same principle again, I should say, with the middle, or yeah, the middle letters. Okay, medium size, middle letters, whatever you want to call them. Alright, so again, I'm going to point to the letters. We're not going to do it every one, okay, because it takes too long. Okay, it's far too long. So with the left eye closed for me. Alright, tell me to the best of your ability. Here we go, left eye closed, thank you. Good. Well done, and now you guessed it, close over your right. There we go, and again, tell me what the letters are to the best of your ability. Here we go, the right eye closed, thank you. Okay, that's fantastic, well done, yeah. We're putting this chart away now to be seen again, alright, so we'll be relieved to know. But you did well there, we know your current eyesight, so yeah, I'm happy with how that went, alright. Good. Right, we're going to be checking your what we call the pupillary reflexes, okay? In order for me to do this, I need to dim the light in here. Okay, so we've got two main lights. I'm going to turn off one of the main lights, and it should dim significantly the lighting in here. Alright, so stay put, I'll be back in a few seconds, alright? Okay, is it okay if I place my hand on your nose? Yeah, just to split the two eyes. What I need from you is just to look pretty. Yeah, just stand there and keep your eyes open, basically. That's it, that's all you got to do. Alright. Okay, good, here we go then. So let's check any direct. And then the consensual response is good. We'll do all four corners. Direct. Consensual, good. Both eyes should mimic one another. Whether or not it has the light shone into it, okay? Good, that's fine. Just a few more checks. Good. Let me change hands and make it a bit easier for myself. Good, and the final one, direct. And concentrate. There we go. That's fantastic. Okay. Good. Put this light back on so I can see what I'm doing, alright? You're doing very well, okay? So we are about a quarter or so of the way in. And yeah, well, maybe more, just over a third actually. Yeah, okay, that's fine, no worries there, okay. So we're going to be doing what I call a swinging, well, not what I call, it's what everyone calls a swinging light test. Okay, so it's quite simply, I'm going to be swinging the light from one eye to the other in a U-shaped pattern. Okay, so just back and forth like that. And again, you've just got to look forward and, well, look anywhere really and just keep your eyes open. Alright, here we go, getting quite close then. So just keep the eyes open as best you can. So swing the light from one eye to the other and back again. And so on and so forth. Good. That's fine, yep. Alrighty, so again a few notes, and again we'll move on to the very next step. How are you feeling? Are you feeling okay? Because that's the main thing. It's not how I'm feeling, it's how you are doing. You are the patient, you're the one that's getting looked after here. Feeling alright? Okay. Good. Alright, so conventional reflex, convergence and constriction. What I want you to do is focus on my wonderful blue bear-like animal. I imagine it's a bear. What do you think? Is that a bear? I think so. It's pretty happy and cheery, and it has yellow, rosy, yellow cheeks. Okay, anyway, if you could look at the bear with both eyes. Okay, that's fine. And in a moment I'm going to ask you to switch your focus to a point on the back wheel behind me. Not quite yet though, so keep looking at the wonderfully happy, cheerful blue bear. Okay, it's good. And now if you can switch your focus to a point on the back wall there. Okay, keep looking at the point you've picked on the back wall. That's fantastic. And again, if you look at the blue bear on the end of my yellow and polka dot and white striped and white polka dot pencil, that's predominantly yellow, with Happy Day written on it. There we go. Yes. Okay, relax for a moment. And again, if you look at the not scary at all blue bear with the not creepy smile. Okay, and now look at a point on the back wall for me, over my left shoulder. Good. And back at the blue bear. Okay, now follow the blue bear as I move it backwards. Keep following the blue bear. Yeah. I just wind my patients up doing that. That's not part of the test. Yeah, you'd be amazed at what people follow when you ask them to. Sorry about that. Okay, not at all unprofessional. Yeah. Alright, visual field check now, okay? So I'm going to be wiggling a finger. Okay, we're going to do the four corners. Okay, so top right, or your top left, your top right, your bottom left, and your bottom right. Okay, I'm going to be asking you to close over one eye. So if you close over your right eye to begin with, I'll close my left. Now you need to be looking at my nose at all times, okay? I want you to tell me when you see my fingers in your vision, okay? The key is you've got to look at my nose. Here we go, looking at my nose, tell me when you see my fingers. Looking at my nose when you see my fingers, tell me. Good, and we're going to switch eyes, so if you can cover over your left eye this time. Looking at my nose at all times, tell me when you see my fingers. Good. Good, we'll do the same again on the other side, okay? So repeating the process, covering your left eye this time. Tell me when you see my fingers, sorry, covering your right eye, I did get that wrong. Your right eye, yep. And tell me when you see my fingers, look at my nose, okay? Look at my nose all times, when you see my fingers, tell me. Good, and now you close your left eye. I close my right. Looking at my nose at all times, tell me when you see my fingers. And final time. Okay, hold on. Yeah, I do get my lefts and rights mixed up more often than I care to admit. Yeah. Alright, no worries there. We'll do a fundoscopy next, okay? It's a real term. That's a real test. Okay, so we're going to use the Fundoscopy for this. Okay. So we've got about 10 or so minutes to go. You're doing really well. I'm very happy with how it's going, so I'm sure everything's going to be fantastic on the end of this test. Alright, so pop this on here, we're going to turn off this thing on, and make sure I've got my correct setting here. There we go. Okay, so I'm going to be shining a bright light into your left eye to begin with for about 2 seconds, okay? So I'm going to be doing that in 3, 2, 1 now. Yeah, let me turn my Fundoscope to the correct way. And we're done, all done. And into the right eye in 3, 2, 1 now. And we're done, all done. It is a bad habit, turning the Fundoscope sideways. Yeah. Took me many months to kick that habit, and as you can see, it's not completely gone. Alright, so now I'm going to be checking the red eye reflex. Okay, so I've got to change my setting here. And again, I'm going to be showing a bright light into your left eye. 3, 2, 1 now. We're done, all done. And into the right eye. 3, 2, 1 now. We're done, all done. Alright, next step, then another light needs to be shone into your eyes. I know, I'm a bit annoying at this point. This is 3 lots now. I understand it's a little bit difficult, but I'm going to be slightly more annoying now because I have to put some drops in your eyes. Is that okay? Feeling brave? You got this. Alright, if you could just raise your chin up ever so slightly, I promise you they don't sting or bubble or fizz or anything like that. You won't feel them other than sort of extra moisture on the eyes, okay? I promise you. You can trust me, alright? It's not going to hurt. Okay, so move your chin back ever so slightly. There we go. You're very brave. Very proud of you. There we go, and blink a few times. Okay, keep blinking. We're going to do your right, your right eye now. Okay, so here we go. 1, 2. There we go, and blink away. Blink, 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 blink. Okay, just making sure the eyes, all the pupils are dilated. Okay, keep blinking away for me. How does it feel? Not too bad. Okay, keep blinking away. Okay, I'm going to dim the lights again, okay? Alright. You're doing really well, alright? Good. Okay, so again I'm going to shine a bright light into your left eye to begin with. Once I check my setting here. There we go. Alright, so shine the bright light into your left eye. 3, 2, 1 now. Done, really well done, and into the right side. 3, 2, 1 now. And we've done, fantastic, well done. Right, no more lights shining into the eyes, at least from what I can remember. Certainly no really bright stuff anyway. Alright, so you've done very well. Put the light back on. Yeah, so I've just got my glove caught on the light switch. It happens sometimes, so I have to turn it back off and on again. Is that right? Back on? No, back on and off, and then back on again. I confuse myself sometimes. Okay. Any double vision at all experienced recently? I've got a mosquito. Yeah. It's that time of year, unfortunately. Yeah, they do bite, so just be prepared. I mean, you're in a good place, let's be honest. I can, hear them buzzing around my ear now. It's quite annoying. Yeah. Go away. Alright. So yeah, like I said, you're in a good place. If you do get a bite, you're in hospital, so I can think of worse places to get bitten. In more ways than one. Ouch. Okay, well there we go. So that's no vision, double vision at all, but possibly some mosquito bites. Okay, no worries. Alright, we're going to do the fine touch sensation and the pin and prick sensation. Okay, so we've got a soft implement here. I'm going to brush this across the face nice and gently. I'll show you how it feels. There we go. So I'm going to be brushing this across the face at 6 very strategic, very important, very scientific places. Okay. And I want you to tell me afterwards, did it feel the same both sides? Okay. So, and also, did it feel soft each time? Okay. Alright, so here we go then, nice and simple. Good. Okay, did it feel even on both sides of the face as I was brushing the... Okay, and did it feel soft each time? Okay, that's wonderful. Same again with a sharp object. I'll be very gentle, don't worry. I'm going to show you how it feels, okay? So keep it nice and still. There we go. Wasn't too bad, was it? Right, same again then, 6 strategic, scientific, necessary, mathematical places on your face. And then afterwards I'll ask you did it feel the same both sides, and did it feel relatively sharp compared to the soft object? Alright. Here we go. Okay, so well done first of all. Did it feel sharp each time relative to soft object, excuse me, it is late, I'm getting tired. I think I need some tea, a bit of caffeine, you know. Felt, yeah, okay, and did it feel roughly the same each side of the face? Alright, that's cool. That's fine. Okay, we're checking your jaw jerk reflex. This ridiculously sized hammer. Alright. I'm going to be hitting my finger, not your chin directly, okay, so don't worry. We're not going to be sort of smashing you on the chin. Unless I miss, and that would go, yeah. It's not happened yet. So I'm going to place my finger on your chin, if that's alright, and I'm going to be hitting my finger with the hammer. I'm going to do this 2 times, alright? You've got this, you can do this. Alright, so don't clench your jaw and don't open your mouth, so just sort of keep your jaw nice and relaxed as if you was watching TV or something. Yeah, something like YouTube. Yeah. Okay, so on the jaw, there we go. And relax, relax, relax. good, that's fantastic. I'll do this one more time, okay? How did that feel first of all? Okay. Okay. Thought you'd be alright. Alright, you're being brave, so well done. There we go. Second time. Okay, that's fine, well done. So again, I'm just going to make a note of that. The jaw just gave me that sort of jerk reflex, jolt that we're looking for. Okay, so always good with that. Good. Right, we're going to do some facial expressions. Okay, so I've got a list here of things to ask you to do. This is to do with the facial nerve. Okay, so it's cranial nerve number 7. Okay, in case you was wanting to know, you wasn't interested. That's right. Okay, could you raise your eyebrows for me and keep them raised both sides? Okay, that's fantastic. Alright, I'm going to ask you now to just get us back. If you can close your eyes for me, I'm going to try and open them. I want you to keep them closed as best you can. Alright, here we go. Close your eyes and keep them closed. I'm going to try and open them, keep them closed, keep them closed, keep them closed. There we go. Open your eyes and relax. That's fantastic. Well done. And let's see, okay, if you can puff out your cheeks for me. Yep, and I'm going to try press them in. I want you to keep them puffed out. Here we go. Keep them puffed out, keep them puffed out. And relax. Well done. Okay, this is always the sort of entertaining part of the cranial nerve. Okay, if you could do this as if you was applying lipstick in a rather strange and comical fashion. Okay, keep it there. Okay, fantastic. Yeah, good job. It's fine, okay, and if you can give me a big teethy grin so you can show up all your wonderful teeth. Yeah. Okay, you have interesting teeth as well, there we are. Alright, have you noticed any changes in taste recently? Okay. Have you noticed that your hearing sounds any better than usual? Alright, so with that said, I'm going to quickly physically inspect your ears. I'm going to be touching around your ears, is that alright? Alright, if you're at any stage you're in any sort of pain or discomfort, no matter how small, do let me know, okay? I'm sure I'll be fine, but we've got to check this anyway. Alright, there we go. Alright, so. Any pain when I do that? Okay, that's good. Okay, and I squeeze here, does that cause you any pain? Okay, so I'm going to look on the other side. Painful at all? Okay. When I squeeze here, does that feel alright? Alright, that's fine. Yeah, I'm pretty happy with that then, so I'll make a note or two on that and we'll be all done in a couple of minutes, alright? Yeah, it's gone pretty quick, hasn't it? Best part of half an hour, believe it or not. That's fine. Alright, I'm going to whisper some 2 numbers and a letter into each ear. I want you to repeat back one whisper, okay? Alright, here we go. 2, 3, L. Good. 7, 4, Y. Okay, that's fantastic. Okay, so a quick look into your mouth, if that's alright. Alright, if you can open your mouth as wide as you can without it being uncomfortable, and say ah. Keep saying ah. Alright, fantastic. And close your mouth, that's wonderful. Okay, so if I observe symmetry, that's fine. Alright, if you could shrug your shoulders for me, keep them up. Okay, and relax. Okay, I'm going to place my hands on your shoulders, you can shrug them again. Okay, very good. Now I'm going to be pressing down to keep them up by your ears. Okay, so keep your shoulders up, 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 up. And there we go, relax, that's fantastic. Alright, I think we'll leave it there then. No worries at all. Okay, so everything is fantastic. I appreciate your time, and we'll no doubt see each other again in the not so distant future. Alright, take very good care of yourself. Okay, I mean it. Take good care of yourself, alright? Alright, so I'll see you again very soon. You've been an amazing patient. I wish you all patience.